had it. Online Peterson's got it. That thing is gigantic. Like, if you did that, you can't even drive down the road without the head on it.
Good grief. They're there for their 15 minutes or something.
Oh, wow.
You know, they make it stop. Kind of like we're gonna do over here. JJ's gonna try to grab that one. I think that's the 28th.
What's that like?
That's for our jail.
Oh, Dita's gonna be here too for broadband. That's gonna be our open meeting in Hookley. That's coming up too.
I'll be at my hearing doctor that day.
Oh. Ain't it great?
Okay, we will begin, but before we do, I just want to remind everyone that our board meeting is live streamed and on YouTube. So if you are going to say something, please come up to the microphone so everybody can hear. And with that, we'll call the meeting to order and rise for the pledge.
I
pledge allegiance to the flag of the United States of America
And to the republic for which it stands, one nation,
under God, indivisible, with liberty and justice for all.
Okay. Public forum. Does anybody here wish to speak at public forum? Nobody? We'll move on to the agenda. Any changes, additions?
No changes or additions to the agenda, Mr. Chair.
I'll move the agenda.
I'll second it.
Motion by Ludwig, second by Lovegren. Any discussion? If not, all in favor, say aye.
Aye.
Opposed? Reese, just so everybody knows, Reese is on sick leave and he will join us. You know, so if we have questions during the public hearing, he'll be coming in via interactive TV. We'll move on to approval of the minutes of the August 15th County Board minutes and summary for publication, August 22nd special meeting, Committee of the Whole for budget, and the August 29th special meeting, Committee of the Whole for budget.
I'll move the minutes.
I'll second.
Motion by Lovegren, seconded by Waldham. Any discussion? If not, all in favor, say aye.
Aye.
Opposed? Minutes of the reports, all we have is the county surveyor monthly report for August.
I'll move that.
I'll second it.
Motion by Moore, second by Lovegren. Any discussion? Hearing none, all in favor, say aye.
Aye.
Opposed? We'll move on to the consent agenda. You've had that in front of you for a while, so anybody has any questions?
I'll move consent, Mr. Chairman.
I'll second it.
Got a motion by Lovegren or Ludwig, seconded by Lovegren. Any discussion? If not, all in favor, say aye.
Aye.
Opposed? That brings us up to our regular agenda, and first on the agenda is the cannabis ordinance, public health, or public hearing to be held right now. And so presentation by staff is what we
Yes.
have first.
Mr. Chair, members of the board, on August 1st, the use, possession and growing of cannabis within certain limits for those 21 or older became legal. Adults over 21 can use cannabis outside in public places such as parking lots, sidewalks, and parks. State law prohibits smoking at any location where a minor could inhale the smoke. Under the new state law, local governments such as counties may adopt an ordinance restricting the use of cannabis in public spaces. The ordinance as drafted would prohibit the use of cannabis in a public place or a place of public accommodation. These terms are defined in sections 2G and 2H of the ordinance, but they're somewhat self-descriptive. The exceptions are covered in section 2I. The ordinance does not apply to a private residence, to private property unless prohibited by the owner or at an establishment or event licensed to permit on-sale consumption. If there are other exceptions that the commissioners would like to consider, such as the memorial forests, any other exceptions could be added in section 2I as well. Additionally, since this is a county ordinance, it does not apply within the corporate limits of cities or within state parks or state forests. This ordinance also does not regulate the licensing of commercial cannabis related businesses. I would now like to invite Sam Lowe, Director of Pine County Public Health, to speak on the health impacts of secondhand marijuana smoke.
Hello, I'm going to keep this super brief because none of this should be a surprise to anybody what I'm about to say. So there's a couple things we're just worried about in terms of public consumption of cannabis. One, as Dave mentioned, is the secondhand smoke, and that's true for both youth as well as adults. If people are not actively intending to smoke it, which is not great for your lungs anyway, that secondhand exposure, you get the same impact on your lungs in terms of particulate matter in your lungs and that impact that can have. So just not ideal. Oh, my phone closed. There we go. Second, around normalizing the behavior, it is going to become more normalized, but kiddos seeing that is just not ideal. We want them to not find it this super normal thing that everybody just does. So just keeping it out of the public space will help limit that exposure as much as, we can. Public impairment, I'm going to lean on the sheriff's office way more for that one, but don't love that because as much as you don't want to see somebody drunk walking down the street, you don't want to see somebody high walking down the street. Like, stay home. And then the last piece would just be unintentional ingestion by children. So just having it more in the public space just increases the risk of kiddos potentially having access to everything from the plant to edibles to whatnot. So just the more we can do to just try and keep it home, safe, away from kiddos is just good for kids and grown-ups. So any questions from a public health perspective on public use of cannabis? Happy to answer.
And just one more comment on the staff presentation, that violation of the ordinance is a petty misdemeanor with up to a $300 fine.
Thanks, y'all.
Thanks, Sam.
Anybody else? That's it for the staff presentation for now. And so we'll turn it over to the county board for questions and discussion. Anybody?
I think the only thing, because I raised it last time and I've been giving it some thought, it's the memorial forest site.
Yeah, I do. And if I understand it correctly, the state forests, we have no control over. So I would think our memorial forest would fall into that same. I mean, I'm looking back here towards Jeff because he's, I don't know if that's a harder thing to police or take care of than, if they're out here in the parking lot smoking versus out in Shangwatana.
Mr. Chair.
Yes.
So I know what originally I thought, why would we, when my comments were, why would we exempt or why would we put the ordinance in the memorial forest? And then I was thinking about it since then and the argument like you can drink in them or whatever isn't really the same, because that goes in your body and the smoke doesn't go in your body, because sometimes you could have other people in the memorial forest too than the smoke is there. So, and then the other thing I think about is like, you can't have alcohol in a park either, right? But everybody has alcohol in the park. And so what happens with that, from at least in my background, that it's discretionary, right? But if the law is there and then there is a problem out in the memorial forest or in a state park for that, then the officers that respond somewhere have a tool that they can use. So, I guess what I'm trying to say, if we leave it in there, it's probably gonna be harmless unless it's complaint driven. And there's an issue, and then if the officer or our officers have to respond, at least they have a tool in their toolbox to do something about it, so. I kind of changed where I was because of that, I think. Because they'll still use their discretion, no matter where they go, you know, if it's nobody around or whatever, and they don't have to write a ticket, they can do warnings or something like that. So, I don't know, maybe Jeff, if does that fit for you, something like that?
Mr. Chair, members of the board, that is kind of where I've been the whole time. So again, I'm not suggesting that we make laws to make laws or make laws that we ignore. But I think
You're right.
that deputies on the scene have discretion and the ability to use discretion if there is a petty misdemeanor that might attach to it as well. So my stance now is the same as it's been. I don't know that it's going to ever be enforced, but at least having a tool, something we can fall back on instead of just saying, there's nothing. That's just a bad answer.
Yeah.
But if we have something we can work with, it does help us to outcomes.
Thank you. That helps.
So when I was reading this, the whole thing that I kept thinking was hearing Jeff say, if we have something to stand on, you know, it will be a benefit to the department. And so that's where I'm at, is this will give them that leg to stand on. So thank you for going through that.
Mr. Chair.
Yeah.
Is it legal in a state forest or?
I think yes, it would be.
Last, Mr. Chair, members of the board, last I heard like month or so ago, the DNR was reviewing what it was going to have for rules, and I just don't know.
I think we're in a year-long learning curve here. And so we'll probably do something and come back in a year and maybe have to do something different, but I think we're gonna try to do the best we can with the information we have at hand right now.
Mr. Chair, I have a
Yeah.
comment. Is it the smoke, secondhand smoke thing you're thinking of, or the fire chance of like burning a forest down? Because can you,
Both. It could be both.
can you smoke cigarettes in a?
Yeah.
Yeah.
You can smoke cigarettes out there, so
Yeah.
that's already.
Yeah.
I mean, so you'd have to, I would think, then ban people from
Well,
having a cigar when they're out celebrating, shooting that big buck, then you can't do that then.
no, I agree.
Yeah.
It would be, but that's why I say if it would probably never be an issue, but but it's nice. And I see that's the argument, you know.
Yeah, and then there's other means. I mean, alcohol is usually consumed, drank. There's other means of enjoying your cannabis, right? Isn't there edibles? I mean,
Right.
there's other, so,
You're right. It's because it's a
how do
legal
you,
substance.
to be
right?
more towards Jeff, how do you
I was there too.
find out when they're under the influence is really the thing then.
But that's why I came down where it's like. It probably wouldn't be a problem if you'll get a group of ATV or somewhere camping and it's all hell breaks loose and the cops get called in and then they just have a tool. Otherwise, it would never be, it'd be complaint driven. And it's like, we have to start somewhere. And if it looks like it's a problem, we can fix it just as quick. So,
They invented the vape because of the smoke, and then people didn't like the vape because it looks like smoke. You know,
Chemicals are still there.
Yeah.
And to me, there is a difference between tobacco and marijuana smoke in that, marijuana is more psychoactive and does affect your brain perhaps more than nicotine does. So I think there is a difference in tobacco and marijuana and the secondhand smoke.
thank you, man.
Any more questions? Not, we'll open it up to the public. If anybody from the public has a comment, welcome it now. I can see throngs of people approaching the podium. But if we have nobody, that's fine. In that case, we'll close the public hearing part of it and the board has questions. Reese is online if somebody has a question of his opinion, but
My only comment is we should periodically revisit the ordinances anyway as a board, right?
right.
So we can just say we're gonna do it.
So I think we're down to the point that if we want to consider the ordinance 2023-40. At this point,
Mr. Chair.
yes,
Does the ordinance, that we have, does that include the memorial forest or not?
Yes.
It does. Okay.
Yeah.
So this one does. All right. With that, then I would, make a motion for ordinance 2023-40.
It does include that you cannot. use
Yeah.
cannabis. Okay.
Yeah.
I'll second this motion. I just wanted to make sure I
Yep,
answered. the question.
that's-
You were thinking
Maybe I
that.
didn't say it right either. Thank you for
we
clarifying.
got a motion by Moore, second by Lovergren. Is there any more discussion?
Yeah, the discussion, the memorial forest, is that looked at the same as the state forest then? Because you can do this in a state forest or not?
State will have their own ordinance.
David was just saying that the state's still looking at it. They haven't come through with what they're gonna do with that yet.
So we could actually be then more restrictive than the state if the state doesn't do anything in their, on their state park, state forest?
Yes. We could be.
You can't be less restrictive, but you can be more.
Yeah, then I would, can I amend the motion saying that I would like to leave this memorial forest until we see what the state does?
Josh would have to amend that one too, because he made the motion.
And the reason I did it is just because I think it's a good idea to have it that way. Technically, you can drink alcohol in Memorial Forest and you can't on the state. So, but I'm assuming they're gonna come right along with it. So that's, I like giving the sheriff's department, if there is an issue, they can enforce something. So, and if it creates a problem, we can always amend it later. But I'll leave it the way it is.
I appreciated the fact too that Jeff had said that they're not gonna go out there looking for people that are doing it, but if they do have a complaint, then they've got something to stand by.
Based on the amount of input that I've had from the public, I'm guessing this isn't the top issue in the county. And I think we'll take the lead. I don't know. It sounds like a pretty good thing to help our law enforcement at this point until we know what's really going on, and maybe in 6 months we'll know a lot more and we can come back and change this. Anyway, any more discussion? If not, all in favor, say aye.
Aye.
Opposed? All right. Thanks, David and Sam. Yep. Health and Human Services Advisory Committee minutes are attached. Terry, we kind of covered most of that in our budget meeting.
Mhm. It was a good meeting though.
Or not Terry, I mean Matt. I'm sorry.
We knew. But I'd like to add that I did reach out to, because we are going to be bringing this stuff up at the Association of Minnesota Counties, what our needs are as far as public health. And I reached out to Sam and Becky, and I just want to, I appreciate your quick response and thoroughness on your responses, and it will be supported. So thank you for that. I appreciate it.
Then we'll move on to Operation Community Connect update.
Is me. Good morning, Mr. Chair, members of the board. My name is Becky Foss. I'm the Director of Pine County Health and Human Services. And it is a pleasure and an honor to be here today, just offering a brief recap of the 2023 Pine County Operation Community Connect. We call it OCC, so that's the acronym we'll be using today. The event, the OCC, was hosted this year by Pine County Health and Human Services and the United Way of Carleton County. And don't be fooled by that name. They also serve Pine County, United Way. We held it at the Hinckley Finlayson High School. So the next time you see your school partners from Hinckley Finlayson, give them a big thank you because their venue was amazing and it was able to fit all the vendors we had. And that was a real concern. Additionally, it was a nice place to have a catered meal from a local vendor. So just a beautiful space. Cannot thank Hinckley Finlayson enough for that. This year was a little different in that we held our OCC in August versus October. And the goal of that was really to support children and families by being available in the summer before they were going to school and offering some back to school resources like backpacks. The PTOs in the area have school supplies kind of covered, but we figured backpacks and we heard backpacks was a real need in the area. So that was something we had done with the goal of having 200 community members or more show up. Previously, we had anywhere from 150 to 175. Very happy to report that we had over 300 community members show up for the OCC, and we had over 50 vendors. And the beauty of the vendors is they were local and regional resources for the community, ranging from financial assistance to mental health to chemical health to dental health. So just a nice array of all the services and resources that somebody may be looking for at an event like that. We had free haircuts offered as well. There's some connections in-house to a hairstylist, so that is helpful. So that was donated to us, which is really nice. Or I should say the time was not a physical donation. We also had a steering committee this year because we knew things were changing, and because of the time change from October to August, it really put Health and Human Services more in a driver's seat role. Previously, the United Way we were co-facilitators, but the United Way really drove most of that with some help from Health and Human Services. And we flipped that this year it was mostly driven by Health and Human Services staff with facilitation by United Way. So I wanted to give a quick shout out to the members of the OCC steering committee. Those were led all the time by Haley Friedland, who's just an awesome public health educator. Public health educators Krista Jensen and Janae Hicks were also part of the steering committee, as well as Cassandra Olson, myself, Michelle Gruel, Lisa Stoffel, and then Sarah from the United Way. We had various financial sponsors as well, including many area Lions groups, the Pine City one, the Pine area, the Sturgeon Lake, the Finlayson Geezy Lions. Essentia Health in Sandstone also offered us a huge grant. So that was really helpful in providing a meal to the community. Medica and UCare were also there. So just wanted to give that brief update and talk about the success that it was. Thank you.
Thanks,
Heard really
Becky.
good things about it, Becky.
It was amazing. They did a great job.
300 people.
Yep, 305 to be exact.
Thank you.
Thank you.
Essentia Health report for the fiscal year 23. Thanks for coming.
Yes. Alrighty, so my name is AJ Skwaczynski. I'm our EMS supervisor for our Sandstone operation, which would encompass the vast majority of Pine County. So this last fiscal year, our fiscal year at Essentia starts July 1st, ends June 30th each year. Our Sandstone operation, we responded to a little over 4,300 responses last year, which compared to FY21 was a 14% increase. It's our largest multi-year increase we've seen. We currently operate 3 bases in Pine County on a permanent basis. Our Sandstone base, which is right next to the Sandstone Hospital, our Hinckley base, which is inside the Hinckley Fire Station, and our Pine City base, which is a few hundred yards behind the board. So inside that service area, we have portions of 3 different counties. We have Aiken County, we cover 1 township in, we cover the northern part of Kanabec County. And then between our Sandstone operations and our Moose Lake operations, we cover all of Pine County with the exception of the immediate area around Brook Park and areas west of Highway 107. We do have the county jail here. We also cover the federal facility up in Sandstone. We cover Grand Casino and all the portions of the casino there. The Mille Lacs tribal properties out on the eastern part of Pine County, and then 3 state forests. Just in our sandstone operations, we have 70 miles of interstate. When you add our sandstone and our Moose Lake operations together, it's about 70 miles of interstate we cover. So our makeup at Essentia Health EMS, all our ambulances are a one leadership team now. So we have bases out in Ada, Minnesota, which covers almost all of Norman County, Detroit Lakes, Boston, our Deer River operations. And our newest base to us right now is our Buell operations up between Hibbing and Virginia. We have two medical directors. Our primary medical director is Dr. Chris Anderson. He's a division chair for emergency services at Essentia. He's based in Fargo, and we do have a new associate medical director to us this last year. His name is Brandon Dravich. If you've ever been to the Sandstone ED, he's one of the ED docs that's fairly frequent down in the Sandstone area. So he does come out and do some ride-alongs with crews on the east side of Minnesota. So he's been out here with me a couple days and done some ride-alongs. We currently have 7 ambulance licenses throughout Minnesota. We have 9 base locations. We have about 150 EMS clinicians, so that's EMTs, paramedics, and a couple emergency medical responders. We have 6 community paramedic locations now. There would be in Brainerd, Fargo, Detroit Lakes, Ada, Deer River, and Duluth. So that's our biggest growth lately has been in our community paramedics. All in all, throughout all of Essentia EMS, we did about 13,000 responses last year. We have one centralized billing office, which is based in Brainerd, Minnesota. Our billers do work remotely though, so. We have an interfacility dispatch center out of Duluth, so they coordinate all our interfacility medical transports for us. That's been a big change. It's very nice. So instead of having 5 of our sites get a phone call from a hospital about a transfer, they call one location and they can find the closest ambulance or the ambulance that's going to be there soonest. We used to in years past drive past each other on highways, going to transfers opposite directions. And right as of today, we have 23 ambulances in our fleet.
Ask you a question.
Yeah.
6 community paramedic locations. What exactly does that mean?
So our community paramedics, and Mitch might be able to expand more here. Our community paramedics, they are focused on acute care post ER discharge or post hospital discharge. So their goal is to decrease the workload on a system. So a patient that's comes into an ER frequently, they can be assigned a community paramedic to help them. They'll do a home visit, like a safety assessment, help organize medications. And then sometimes when they get out to a home, you know, if you have a COPD patient, it might get there and realize, okay, you have a whole bunch of asbestos in your house. This is something we should look at, or your home environment isn't the greatest for healing. We do have a program out in Fargo right now. Is Hospital in the Home still open? Hospital in the Home was a program that started this last year. It's been a trial out there where we actually admit patients to their house. And a community paramedic stops out multiple times a day. They're generally low acuity patients. They're not high acuity. So instead of taking that med surge space up and cutting down, you know, a nurse, if they have a 1-to-6 ratio, that allows one more patient with a higher acuity to be admitted. And they've had really good success with it. One hard thing with community paramedics, there's not a lot of them out there. The program started in 2013, and it's been very slow, and COVID really slowed it down further. I think there's 180 community paramedics in Minnesota, and we employ roughly 10 or 12 of them.
Okay, thank
So-
you.
How does that work? Does the ER doc then say, do they put it on the release that, and then you guys get notified to do a follow-up at the home?
I'm not directly related to our community paramedic program, so I don't want to speak on their behalf on every aspect. But they can do referrals to them. And that's why, you know, a lot of our community paramedic programs aren't in areas we have ambulance services unless we have a hospital and an ambulance service. Other ambulance providers in Minnesota have tested doing community paramedics with their ambulance. They have a lack of connection there because they don't have access to their patient care reports for hospital data for Epic. So there's a lack there, and community paramedics, it's a losing proposition. You're going to lose money in them, and a lot of money. It's just what you're going to save on the readmit costs and all the extra fees that come with it. So they're a cost saver, not a cost maker by any means. Nice thing about the community paramedics though is if you have someone with a shoulder injury getting later in their career and wants to stay involved, it's a great way for them too, and they can use their years of experience to help people long term. So some advancements and some patient care changes we've done in the last year and a half. We purchased a new ambulance. It's actually the ambulance that's in Hinckley. I forgot to attach a photo when I sent the PowerPoint over, but it's a box style ambulance. It's got a Ford front end on it. It was about a $205,000 investment in the community. And then this October, we're expecting a remount of an ambulance. So one of our other ambulances, we sent it down to North Carolina. They take the box of the ambulance off the truck and pretty much strip it down to the bare metal and replace everything in it and put it on a brand new chassis. Let's put a $50,000 cost savings by doing it that direction. That's supposed to be back here in October, hopefully. There's been a huge backlog of ambulances. It used to be a 6 to 8 week window we used to have when we bought ambulances. We're now getting quoted 1,100 days by a new truck. So this ambulance that's coming back, I sent down there in March of 22 and it was supposed to be 6 to 8 weeks. I'm just getting it back.
Oh, wow.
So. But the truck was ready for it. It had almost 400,000 miles on it. We got every mile we could. One other thing we did that was probably one of our biggest operational changes is we integrated with both Pine and Carlton County for access to their computer aided dispatch. So all our crews have iPads in the vehicle now and they can see where the other trucks are at, the calls. They can see the dispatcher notes of a call. So one thing that we did lose when the Pine County went to the encryption route was we didn't get that connection as much of all the updates. So we were able to get a lot of that back now by seeing CAD notes. That's been extremely helpful for our crews. That was about a $10,000 investment when everything was said and done between the iPads, the mounts. We had to update our routers, internet connectivity in some of our trucks. They were scheduled to get replaced the next few years. We had to do those a little earlier than we thought, but that's been a great system. There's still some room for improvement there for us, but it's been working well. Other big change we did is we changed our patient care reporting. Our crews have for 5 years now did all their patient care charting on iPads. The NEMSIS, it's called, which is a national organization in the United States. They collect all EMS data and tell states what they have to obtain, and then the states tell us what we have to tell them. They set their standards to change come the end of this year. We decided to go about 6 months early on that, which is great. It was great being one of the first service in Minnesota to transition and one of the first services to switch. The challenging part is our legacy data now is very hard to correlate. We used to talk about how often we transported someone versus how often we went to a call. One question that we used to ask for that is now 4 questions. So it's a lot harder to compare year to year now. With that though, we took the opportunity to change it. So our crews now, they walk into patients' homes with their iPads in their hand and they start documenting right away. As soon as we obtain information, we start documenting as fast as we can. It's patient care, point of care documenting, gives us better data in so we can get better data out. And then we're working on the integration with our hospitals around us so we can start sending that data early to them. On most of our encounters, it's not going to change a lot of things, but a stroke patient's a great example of that, where if we show up to a hospital, a lot of times they won't CT these patients until they have their demographics, allergies, medications, and have a history of them. We can send that early now. So we revised all our medical guidelines. We used to use protocols, which were very black and white. You must do this, you cannot do this. We changed that terminology throughout our entire guidelines to the word guideline. They're there to guide our crews. Our new medical direction team very much believes that paramedics should be paramedics and allowed to use their knowledge and expertise in the field to treat people the best they think is possible. So that created about 500 changes throughout our guidelines, which was quite a bit. With that, we increased our EMT's scope of practice. They now can treat our diabetic patients with dextrose IV versus before we had to give a really expensive medication in your arm and it had about a 50-50 chance of that working. We've added our paramedic scope of practice greatly. We've actually changed our titles, our paramedics to paramedic specialty trained now to recognize the work that they do and the extra care that they're able to provide. We added a medication called droperidol this last year to our truck, which is used in our behavioral health emergencies. Helps with their agitation and combativeness patients a lot. We added TXA to our ambulances. That's for our major trauma patients or our pregnant folks post-delivery. TXA is fairly common in Minnesota. Droperidol, we're one of the few services using it. TXA is common though. We also added nicardipine, which is normally like a very critical care ICU, like big centers administer nicardipine. We use that with our stroke patients to help safely lower their blood pressure instead of just rapidly decreasing it. We also added IV Tylenol. Which doesn't seem like that would be a big thing. I don't know another service in Minnesota using IV Tylenol. We use this for our sepsis care. Our docs come from our sepsis program, so there's some great discharge data on that. And also it provides us another route of controlling pain without using opiates. And then our dextrose 10% solution for our EMTs. We replaced all our radios in our trucks, our vehicle mounted radios and all our portable radios. So we replaced 8 vehicle mounted radios, 25 portables. When we added Moose Lake into our operation, we found that between Carlton and Pine County, our crews had different layouts in their radios, and none of the crews down here could talk to anything else unless they were in Pine County. So if we would have 911 call in Kanabec County, they couldn't talk to them. They did a 911 call in Carlton, they couldn't talk. So we took the time, we talked to all the sheriff's officers around us. We got new letters of permission to authorize us to talk in all these talk groups, and we made it into one layout. So it doesn't matter if a crew member's from Deer River and comes to Sandstone today to work, the radio layout's the exact same. Their guideline layouts are now the exact same. And then the other one with that is their IDs. So when I key up my radio back here, it'll actually show up and dispatch their call sign. Even if they can't have the ability when they hit the emergency button to say their call sign or where they're at, it allows the dispatcher to know who actually was the one who activated that alarm now. So our recruitment and staffing, this has been our biggest focus the last year and a half. We have done an internal scholarship for any of our EMTs that wish to become paramedics. We award them $12,000. We give them about $7,000 before they start school to pay for that first part of school. Once they complete and pass their paramedic test, they get the other $5,000. They're still eligible for all our sign-on bonuses like any other employees. The last year we've had 3 EMTs. Oh, we've had more than that. We've had 5 EMTs become paramedics in our region now. And we have 3 that are in the program. One of them actually just started on Monday morning, so it'd be 2 now left and 6 for the other numbers since the writing of this PowerPoint. So hopefully by the end of this fall, we're gonna have 8 new paramedics in the last 16 months in our program. Our current staffing, we have 1 full-time supervisor in the area. We have 1 shared system-wide manager. We currently have 12 paramedics, now 13 paramedics in our area and 16 EMTs. And we're hoping to have another 5 paramedics by next fall now.
How many of those are committed like to Pine Hill?
All of them. This is just staffing for our sandstone operations.
And that, does that give you then 2 people on at each of the 3 locations, 24 hours a day?
So right now in today's staffing, we staff our Pine City base 24 hours a day, our Sandstone base 24 hours a day. And our Hinckley base is staffed 18 hours a day from 7 a.m. to 1 a.m. Our responses for the year. This is their last 10 years of physical data, so you can see the large up. Every year has kind of been a staircase up. In the last 2 years, we've had big leaps in our call volume.
Is this where you're at right now in 2023?
Nope, this is our physical year, so this had been done June 30th.
Okay, okay.
And this year, the first quarter it's on track to be very similar to last year, about 3% higher.
Okay.
So. This is the breakup where our 911 calls have happened. So about 40% of all our 911 responses happen in Pine City. Do know anytime I talk about a town during this, I'm talking about the zip code, not the physical boundaries of a city. And I'm sure the board's very familiar with the aspect of how these zip codes are laid out in Pine County is very funky. So Pine City, the zip code of Pine City at least, had 40% of all our responses for 911s, 26% were out in Hinckley, 19% in Sandstone, 15 in other towns throughout the area. That 15%, the vast majority of them was northern Pine County, with the exception of Henriette and Rush City. I think the only 2 zip codes that wouldn't be included in those numbers. This is a breakdown again. So we did about 106 calls up by Finlayson, 56 out in Brook Park, 46 in Graston, 33 Willow River, Bruno, Sturgeon Lake, and they just keep going. So we actually did some mutual aid up in Duluth this last year as well. Our crews are up there on transport, dropping people off, and there was calls pending up there. So we helped out in the area up there. This is our 911 destination. So 47% of all our patients we transport in the Sandstone region end up getting transported to the Sandstone Hospital. 39% end up going to Wellia Health over in Mora. 104 of those, or 4% went up to Essentia Health in Moose Lake. That is an area we're seeing the largest growth, I would say, in like destination transfer is patients in Northern Pine County wanting to go straight to Moose Lake. And that's a little bit just how we changed our coverage patterns too, that we're responding to more calls in northern part of Pine County. Grantsburg's been a popular destination. We did about 3% there. 3% went over to Cambridge. Cambridge has gone down in years past, mainly because of the lack of inpatient mental health and OB care now. So those used to be specialties that we bring people to. And then we brought 27 patients either straight to Regions or straight to St. Mary's and Duluth. That'd be our trauma patients and our cardiac patients that are having a heart attack that we can identify in the field. So our partnership, have formed an internal partnership between our Sandstone and Moose Lake operations. We call this our I-35 EMS. So we encompass all of our bases now. So the map up there, which the Moose Lake one didn't really outline very well, outlines kind of our layout. The change to that would be Moose Lake is a 24-hour base of operations for us as well. We staff an extra 18-hour truck in Moose Lake every day from 11 AM to 5 AM. We added that truck because of how many transports we were getting requested for across Minnesota. So instead of basing that truck in Duluth, for example, to do those, we figured in their downtime, they can help with 911 responses down here. We changed our staging plan. Traditionally, our staging plan in the Sandstone operation was if we only had one truck available, they'd move to Hinckley. We actually looked at our run volume data to see like, where is our need of our communities? And we kind of developed the point system and a graphical layout to show better where we can put trucks to have the highest capture rate and the quickest times. So with that, one of the things that changed is we formed a handshake agreement with the city of Willow River. So we have a couple couches and a TV in their city hall now, where crews can park and they can sit down and rest and get a little bit of break. Our Willow River base is most times staffed by a Moose Lake crew coming down to cover the northern part of Pine County. If the Moose Lake service area runs out of trucks due to 911 volume though, we'll move our Sandstone truck up to Willow River to cover that area. So combined with the two areas though, 5,800 responses for the year. We staff 5 ideally paramedic ambulances every day. We have 8 physical ambulances in the area, so we have a few spares. Ideally, I have one with a blown motor right now, so it's not really workable. We do have 2 paramedic supervisors at Essentia. All our team leads, supervisors, managers, and directors are all paramedics as well, so we're available for responses. Underneath full staffing, it's about 60 total staff members and about 1,900 square miles of service area. And that is the end.
You guys are busy.
Do you have a typical, what response time, I guess, from the time a guy calls 911? What is the expected time? And I know mileage plays a difference, but do you have a?
So we require our crews to be en route to a call within 2 minutes currently from the time they are dispatched to the time they go en route. Starting June 15th and July 1st throughout our whole system, we actually started tracking the time a 911 call comes into a 911 center. Right now, though, I'm only able to get that data from Pine County and Carleton County. The other counties we serve, we don't know those numbers because we don't have access to their CAD system. So that's one area we're really trying to find out, is there an area there we can improve our response times in? Currently, we're seeing times of anywhere from 2 minutes up to 7 minutes before our crews are being alerted to it. A lot of times though, it's when someone calls 911, there's not a known need of an ambulance. Domestic disturbance call, it might be 45 minutes from the time a call is received till the ambulance is paged because the deputies haven't found the need of an ambulance until then. So those are kind of where we're struggling to find what's the best times to use. Right now, when we look at response times, we look at our en route time till the time the crew's on scene. When we look at times, just to try and have a fair comparable across our system.
Mr. Chair.
Yeah.
So how do you do your backfilling? You know, like if someone takes a transport or 2 transports are out, and then I've heard you get dispatched somewhere else if they're coming back from a hospital in the metro or whatever, and they send you some because they just need somebody close. And I understand all that. But we still have this big landmass in our jurisdiction. And I've just heard sometimes it takes a while to get an ambulance to some of our scenes and stuff. So
I wish I would have included their staging plan in this report. It was an oversight on my part. So when we look at transports, one thing we have changed is we have always kept 1 ambulance available for 911 response in Pine County. They might be assigned to 911 while they're the last truck available. But the caveat we always used to have was if it was a quote unquote emergent transfer, we'd use that truck for an emergent transfer. We've actually discontinued that now completely. Underneath ideal circumstances, I think we could do those again. The problem is it's so subjective what the word emergent is. You being on a whole bunch of drips might be emergent to a local ED, but to me, you're in the hospital, you're safe, your condition's not going to change, that's not emergent. I don't need to leave a community without an ambulance. So that's why we've discontinued the practice of even asking if it's an emergent transport now. And when we look at a response layout, we have 5 levels of coverage for Pine and Carleton County, and it's pretty much how many trucks are available as a level number. So we have to have 3 on-duty ambulances available for us to take a transport out of the Sandstone Hospital up to Duluth. So if we went down to having 2 available ambulances, we would now have an ambulance in Moose Lake and our last truck here would be in Hinckley. And then if there's another 911 call that happens, depending on whose PSA it's in, if it's a call in Moose Lake, our last truck would move to Sandstone to cover both. But our ideal thing is to try not to go below 3.
thank you.
So then if that happens and there's an accident on Highway 70.
Yep.
That person has to wait for a truck to get from Sandstone to Highway 70.
When it's a call that far south, frequently our crews will ask to call mutual aid. And the big thing we want to hit home with our crews though is we want an ETA of the mutual aid resources. We can get that ETA relatively easy with Kanabec County because we can know where their trucks are coming from. When it comes to ambulance services that serve the southern part or south of Pine County and the county next door, they're dispatched by a secondary PSAP center, which will accept a call and page any truck in their system that's defined as the closest to them. So the big reason that we still send our last truck and ask that ETA is we are finding some of those calls out on Highway 70 and the south part down by Rock Creek. We're having an hour response time where we might have a 35-minute response time, which isn't great, but it's still better than waiting an hour for a mutual aid ambulance to come.
That's what I hear is, we called an ambulance and it took 45 minutes for a guy to get here, and if somebody's laying on the couch and you're trying to do CPR as best you can as a husband or wife or kid, that's a long, long time.
And we try to, that's why we don't go below our 3 is our goal to not go below 3. Because then by keeping at our level 3 status, it keeps us in a truck in Pine City, a truck in Sandstone, and a truck in Moose Lake. So even if the truck is coming from Hinckley, the ideal response time to get down to the Pine City area is still about 15 minutes. And the big one we want to hit home though, we keep trying to help recruit on these is the first responder groups getting out and being engaged and finding a best use to them. We can have an ambulance to your house in 6 minutes and most people will be really happy if you're bleeding out from an arterial bleed. But the 6 minutes is you're just less dead.
So
Unfortunately.
How dependent are you on like the first responders then when it's?
It depends on the service area and where we're at in the county. Some parts of Pine County, we have absolutely great responses from our first responder groups. And I think a little that's just because of the less call volume, like the northern part of Pine County, we have an absolute phenomenal first responder groups that serve up in the Willow River area and the Ascove area. But the call volume is way less. So when we look at like down in Pine City, we have 1,500 responses a year. For a volunteer to be woken up 1,500 times a year, that's pretty high, especially for a small group of 2-3 people. So one thing we wanted to work on in the future is, especially as the sheriff's office goes down the emergency medical dispatch route, is on those low acuity calls where there's not a critical need. There's an ambulance need, but not a critical life threatening need of maybe not waking those guys up at 3 in the morning. This way, when they are getting paged, it's the times that they truly, we need their help right now. And other communities have done this with a lot better success rate and getting higher responses.
Good idea.
So my district runs out to the way east part of Hinckley. So, Lake Lena Reservation and the townships in that area.
Yep.
And what I keep hearing is that their wait times are always long. And I know that they have some first responders out there, but has anything changed then with the way that you've changed?
There is a geographical, logistical, financial problem of the community out there, that there's just not a financial way to put an ambulance out there. I look at some of the townships, they have 200-300 people at them. And their fire departments aren't even serviced by fire departments that are inside of the state of Minnesota. So their fire departments don't want to cross the state line to first respond. The other fire departments out there are having some issues having qualified people be EMRs to respond to calls. And that's where those rural areas supporting their first responder groups and trying to get them education and get them equipment, provided they're willing to do the work to do those things, is the biggest key. Because I look out on the east side of Pine County, we do about 100 responses on a high volume year out in those areas. When you look at the other 4,800 responses, it's really hard to financially support a truck out there. It costs us about $800,000 a year per truck.
So one of the things that we've been hearing too, or finding out, is that it costs a lot for these people to get their education that they need so that they can do the first responding or just be helpful. Is there any way that they can get financial help?
There's a fair amount of financial assistance out there. Pine County is part of Central Minnesota EMS, which does reimbursements for EMR programs, and EMR education. It's just they have to be willing to put the packet in to get the money back. I sit on the Pine County Mutual Aid Group and we've offered these services out many a times to people, and the execution is what we're finding to be the hard part. And I'm one guy, I can't write 14 people's grants every year for them.
Is it hard to recruit the first responders too now?
I would have one of the fire chiefs or first responder group leaders partake in that discussion more, because I don't know. I know me finding staff in the area is difficult.
How about for you guys?
Very difficult. Very difficult for us to find staff. We've been trying to find EMTs that live in the community that are willing to go to paramedic school. That's been our best bet. Most of our EMTs actually are in Pine County or in the surrounding communities, which is really nice to see. It's really helpful for onboarding costs and learning what direction north is and south is, depending where you're at in the county. Those things seem really small, but that's a challenge from someone outside the area to learn. And it's just a different demographic. One slide that's out there right now is from the state of Minnesota. It shows the trajectory of EMS personnel in Minnesota. Last year, we lost 4,500 qualified EMTs and paramedics in the state of Minnesota that let their certification lapse to choose different careers. And that wasn't our 40-year-olds and older. This was our 20 and 30-year-old population, which means this isn't the end of it. This is just the start. So that's why we've been trying to really aggressively hire EMTs and get them trained, get them into paramedic school. And that's where I'm pretty excited right now that we're gonna have some paramedic or dual paramedic trucks coming up this winter, which will be the first time, I think, since Essentia's taken over the ambulance. And definitely since 2015, we've had the ability to do that. Any other questions?
Any other questions, folks? Thank you very much.
Thank you.
Snake River watershed update.
Snake River.
Snake River.
Snake River watershed.
Gotta go with the state. They got me too. So Snake River Watershed, it was a really interesting meeting, and one of the things we were asking about how we could dissolve, and what was said was that we should probably look at withdrawing because the other counties are still uncertain as to where they want to go. The One Watershed, One Plan is taking effect at our next meeting, the end of the end of September. It was interesting when we talked about that we had enough people to make that joint powers work. And some of the commissioners that haven't signed on to it were surprised that they would have no vote in what was going to happen on the One Watershed, One Plan. So that might make some movement happen there. We asked Teresa where the finances were, and she had stated at that point that there was approximately $179,000 in the account. And she did state that if we asked to withdraw, that we would get our share automatically. However, the GPA does not say, or the JPA does not state that. So then it came back, but I think it was last Friday, we got an update that there really is, instead of $179,000, there's $212,410.82 that is unencumbered. And Pine County's share, if we withdraw, or if the membership board is dissolved, our share would be $43,544.21. So the numbers that she gave us was pretty far off. Which is going to be one thing about the GPA or the JPA that's going to be really good, is Pine County is going to be the fiscal responsibility for that. And we haven't been getting really good numbers from the the membership committee as to where the money is on that. It's, the responses are, there has been no changes since June, but we haven't been getting the numbers. So the fact that these numbers and the true numbers are so far off tells me that it's going to be a good thing to have somebody else responsible for that. So what we are asking is, I think we're going to go in and ask for it to be dissolved, is where the status is. Aiken County is starting to question it too, and is on board with that, and Mille Lacs may be there also. Caneva County is meeting with John Kolb today during their meeting to discuss what his opinion is for them to do. The big thing is our share of the money. If we dissolve the committee, will we get our money back? And if we won't get our money back, then we may want to just look at withdrawing from the membership board, as we're part of the One Watershed, One Plan Joint Powers Agreement. So I don't know, anything to add?
Sure, Mr. Chair, Harry. I think the general sense that I get is I got to check my notes because there's so many groups. Once the Snake River Watershed Plan Partnership, this is the One Watershed, One Plan implementation body. Once that starts up in September, the 26th, there's no reason for the Snake River Watershed Management Board to continue to exist. And so, as Terry described, when we were at the last Snake River Watershed Management Board meeting, Terry had raised the issue of dissolution, and the suggestion was that, well, Pine County can leave if they want. And Teresa, who's the administrator of that group, sure made it sound like you could leave and take your money with you. She later followed up and said that the JPA is silent on that issue. But if it dissolves, the money is distributed based on the formula in the JPA. So at this point, it seems to make sense that if the Pine County Board wants to step out on this one, that you would consider a petition to dissolve the Snake River Watershed Management Board. That would trigger the requirement for a public hearing by the Snake River Watershed Management Board. And then the Snake River Watershed Management Board could approve or not approve a resolution of dissolution. And if it does that, then that end of story, everything works out well. If that doesn't, if at the point where the hearing has been held, the resolution has been presented and it fails, then I think Pine County would reconsider, what the next step is, but there's no urgency at this point to leave the agency and leave $40,000
43.
on the table.
554, yeah.
Yeah.
Potential.
That wouldn't make any sense, but.
So don't the two boards end up doing the same job? Why do you need two?
Well,
boards?
The membership
job.
would do less.
And you-
Yeah, but it's like someone's gonna be doing the job you would do.
Right, so everything is duplicated, your insurance is duplicated, all of your fees, so we pay Kennebunk County money to administer it, and we pay them to be the financial administrators. So we'd be paying them duplicates and we'd be paying for the one watershed, one plan. I mean, everything is duplicated, so that's the big question is why? And then the one watershed, one plan is going to be getting over $1 million to spend. And this one only has $212 to spend on projects and they're not getting the projects. One watershed, one plan has some really good projects already in the works that they can jump on. So it makes no sense. It just doesn't.
Mr. Chair.
Yeah.
So, what was my understanding is that the Watershed Management Board could dissolve, but they had to change a few things in the one watershed, one plan. Because is it like this was something that had to be done back in 93 when it was organized. And I thought I remember Bowser saying something about as long as something with the one watershed, one plan. So it covered what the management board requirements were, I guess,
Yeah,
which it does.
So back in the early 1990s, there was a citizen petition to create a watershed district. And the counties at the time did not apparently want a watershed district. And I don't know this directly. I just understand this is the history. So those who lived it can correct me. But the counties did not want a watershed district. One of the reasons that I understand is that it would have levy authority. And so there was no interest in giving that district levy authority. So the counties worked together through an administrative law process to create this Snake River Watershed Management Board that Bowser then believed was responsive to the citizen petition. The citizens who filed that petition withdrew the petition, and the Snake River Watershed Management Board has functioned since 1993. At a meeting of the Snake River Watershed Management Board or the policy committee, at one of those meetings previously, Bowser was asked that direct question as to whether there would be, if dissolving the Snake River Watershed Management Board would allow a citizen petition to form a watershed district. Bowser's answer was a citizen petition can be filed at any time to form a watershed district. The Snake River Board didn't prohibit that. The new board won't prohibit that. What Bowser evaluates when a petition is filed is there actual comprehensive water planning being done in the district? And if there's effective comprehensive water planning in the district, that is the best defense against forming a watershed district. Josh, does that?
Yep. Yeah, I couldn't remember exactly what it was that there was some requirements which the one watershed, one plan fits that plan.
And so as of a couple of weeks ago, all of the local units of government, all of the counties and all of the soil and water conservation districts that have land within the Snake River watershed, except for Chisago County, had approved the plan. And Chisago County and Isani counties are minor players. They have not been involved in the Snake River Board because there's virtually no land area. So I want to discount those, right?
Yeah.
So in essence, everybody who's a player has approved the plan. 5 of the 8 jurisdictions have approved the new joint powers for the Snake River Watershed Plan Partnership. And that's the 4 SWCDs and Pine County. The counties of Aiken, Mille Lacs, and Kennebunk have not approved the JPA. Some of them might between now and September 26, some of them might not. Interesting to me anyways, is that Mille Lacs County is not a member of the joint powers for the Rum River watershed. So to me, that speaks less to anything we are doing or have done and more to how Mille Lacs County views its role in watershed planning under this new one watershed, one plan system.
When the Rum River is huge through their county,
Yeah.
where Snake River is not. So I mean, that's kind of the difference with that too. The other thing that I thought was really interesting with the last meeting is we've got the Citizens Advisory Committee. And they had not been really excited because they're gonna lose their voice. We're not gonna have, their committee won't be anymore either than if we go to just the one watershed, one plant joint powers board. And at the last meeting, they were actually happy about some of the things that are coming on with the one watershed, one plan, and the fact that they will still be sought after for their opinions and stuff. And they're very supportive of having this taken care of and being done. So I thought that was good stuff.
Which right now on the Citizen Advisory Committee, SWCDs are on that.
Right.
But the Citizen Advisory Committee, they recommend to the policy board, but they don't have a vote. So they can recommend whatever they want and the policy board can do whatever they want. So essentially, they're gonna gain a little bit more of a voice. Just the lake associations and the whatever.
Yes, WCDs.
Yeah, they will, and they're there, I mean, they're the boots on the ground. I mean, it just makes no sense.
They're the
I-
experts.
I just don't understand why you wouldn't be part of it if you were in a county.
I don't either.
So, and that question I think has come up at almost every meeting since they have made the statement, we will not be part of the one watershed, one plan if we cannot have a place at the table. And I think at every meeting since that was stated, that question has come back. So are you stating that you would not be active in this committee if you don't have a spot at the table? And why would you not be, and it's the same answer all the time, but it's always asked and their remark is, why would we do all of this work and, bring all this stuff together if we're not going to have a say in what and how is going to be done? Which makes sense because they're the ones with the knowledge. So does anybody have any other questions as far as the committee itself and where things are at? Or any?
No, I
thoughts?
think you've kept us well informed and we'll keep scratching our head till you get it done.
So we do need to consider making a motion to petition the Snake River Watershed Membership Board for dissolution under Section X of the Joint Powers Agreement, and then consider the appointment of the representatives and the alternate to the Snake River Watershed, which would be myself as the member and Josh, if you'll still agree to be the alternate.
Is that a motion?
I will make that motion, yes. Or do they need to?
You
be
want to
done
do them
separately?
as separate ones,
Yeah.
because we'll convey the one of them to the Snake River Watershed Management Board.
So I'll make a motion to file a petition to the Snake River Watershed Management Board for dissolution under Section X of the Joint Powers Agreement.
I'll second.
Okay, we got a motion by Lovegren, seconded by Moore for to petition for disillusionment, you
Dissolution.
understand, of the Snake River Management Board. Any discussion?
Yeah, do we want to put something in there with the, as of the monies owed or anything, or wouldn't that not be necessary right now?
Mr. Chair,
Yep.
I don't think it's necessary because under the joint powers, the refund of the money is spelled out.
Yes.
And so if it dissolves, each county gets its fair share based on the formula in the joint powers.
Gotcha. Thank you, David.
Any other questions? If not, all in favor, say aye.
Aye.
Opposed? Okay, then we should formally appoint Commissioner Lovegren as our representative and Commissioner Moore as our alternate to the which will be the newly formed
Snake
River.
River Watershed Plan Partnership.
Yeah,
I'll move that, Mr. Chair.
okay.
I'll second it.
Motion by Ludwig, seconded by Lovegren. Any discussion? Not, all in favor, say aye.
Aye.
Opposed? All right, thanks, Terry. We'll move on to reports, Mille Lacs Band meeting.
Trying to remember, actually it was an interesting meeting. Jamie's back.
Yeah.
And so, Jamie had been out for a while. He had been pretty sick and, it was good to see him and hear him and just have him be a part of everything again. We're talking about legislative things that we need to get working on. We're still working on qualified expert witnesses for ICWA. We might have some leads, maybe. We're gonna be having a meeting, is that next Monday? To talk about what to do with the extension and kids and how to work with the Mille Lacs Band on that. And so we talked a little bit about that meeting that's coming up too. And then there's another meeting that we're hoping to have this month that's going to involve where they are with their initiative program and what's the other one? Maybe that was,
Initiative Tribe. And
yeah,
We've talked about probation.
yes.
Is that what you're thinking?
Well, and yeah, so there's a couple different things that are coming up with that, but we're gonna meet with their human service department to talk about the initiative tribe and see where they're at with that and how we can help get that going faster. Or get going. No.
Get going at all.
Are they seriously pursuing doing a probation department?
I don't think so.
I think one of the big questions that came with that is, I think they have to do it for all of their counties. They can't just say, okay, we work really good with Pine, so we're gonna do this with Pine County and we're gonna do this with Mille Lacs, we're gonna do this with Aiken. So they have to figure out where they're at so that they can do it.
I think staffing is their biggest
Yeah.
fear. How would they staff it?
Yeah.
Snake River Watershed Managed, I don't think we need to talk about that anymore, do we?
We did that.
We're gonna beat that one up.
Yeah. Land and zoning,
I missed that, Mr. Chair.
Lower St. Croix, we did not have a meeting between our last. Yeah, we haven't met this, we didn't meet this month. Technology was canceled in a month. HRA EDA,
Yes, we had that meeting. It was a general meeting for the two facilities they're managing, and then it kind of jumps into the HRED part of it, and they had the audit presentation, and which was unmodified. And then we knew there had been some questions in the past, and he issued two findings. I think it was documentation of expenditures and segregation of duties I think they were, so. It's in good hands right now compared to where it was, so. And then, the board approved to move forward with a purchase agreement on the North Court apartment buildings that have those site-based vouchers, so we'll see where that ends up. I think there's gonna be a walkthrough and some negotiation and things like that. Other than that, I don't know, it's pretty much a general meeting. Would you say, JJ?
Yeah, there's a little talk about, they still didn't get the appraisals done on the two buildings yet that they, Sandstone and Finlayson, remember we had first
Oh, the alarm or the entry thing?
Well, the appraisals of the value of the building.
Oh, the value for the book?
Yeah,
Yeah.
that still has not been, I know there was discussion early on when,
The value for the capital asset value for the audit.
yeah,
Yeah,
so we're,
that's a number that the auditors need to, in essence, reconstruct as best they can from the limited historical records that they got from the previous management company.
Yeah. It's assets part of the.
yeah, but no, Matt, other than that, that sounds everything I recall.
Schools, counties meeting.
We met in Hinckley. It was interesting hearing what the school's concerns were with the legislative things that happened and what it was gonna do to them and cost them. And they're in the same boat we are. They're being told what they have to do, but they're not gonna be getting all the money that they need to justify it and to do that. And they talked about the projects that they were doing. Steph from East Central said that we should go play on their playground because it's fun. They just got a new playground there. So they were pretty excited about the kids. Joe talked about Pine Technical College and what possibilities are for financing kids with that. There's still some more to learn as to where that's gonna go, but we were talking about how little it would actually take to still participate maybe in meals for the kids or something, you know, just to help make it easier for the kids to go to the school. Because we don't have the money for our ARPA anymore. We just did our last orientation this year. What else did we talk about?
Well, staffing at
Yeah.
the schools. Of course, this was almost a month ago or
Right.
3 weeks ago. And so
They had a hard time.
they had a lot of openings. And hopefully they got them full by today. But, it's a struggle, nationwide if you watch the news.
You know, one thing that we were talking about too is I think that a lot of the standards have been lowered as, you know, we'll take people that have this capability and then we'll do training. And I think that the schools are running into that too, as to who they can take to teach and what they'll do to help get them the certification that they need to teach. I believe that's my assumption from some of the things that I've seen. But, you know, and we were talking about that with probation and what Ramsey County is doing for their probation officers. I think that we're finding with the staff shortages, there's a lot of that kind of stuff going on. So it'll be interesting to see.
Yeah, is that which programs or did they say is most affected by that?
No.
Any other?
I do.
Yep.
We had, we moved Kettle River watershed planning back or because of time constraints on some other issues, but we approved our management structure last week. So
Okay.
it's going to be a joint powers collaborative. And Kanabec County supported, Aiken County supported, Carlson supported, so.
It's nice that you all work together.
And you know, that's what everybody says. Everybody, the SW is a CD representation. That's exactly what they said. This works so good and we're gonna work so good together. And then
Right.
it's just gonna be deciding you know, let the experts run the show and then we policy committee, limited meetings and they know what they're doing.
Right.
Any other?
I have a couple
Yep.
others. So one that I forgot to talk about, which we're talking about the Mille Lacs Band, is the tribal sales tax. And we were asking them for help with legislative and brainstorming as to who we could get to support that. Right now, the tribes can collect sales tax. They get to keep 50% and 50% goes to the state of Minnesota. And out of that 50%, the state keeps 40 and we get 10.
Yep.
And we're asking for 50-50 of the state's share. So we talked with, Jamie was really excited about getting on that bandwagon and helping us in that. And then we talked about that with AMC also. And we will see where that goes, but that would be nice to get some extra cash from that, as we're the ones that do the work through the tribal lands and not the states. So we deserve that, right? The other thing is that I had received a phone call from Terrell Clark from Stearns County asking if I would send a personal invitation to Pete Stauber to have him come and meet with us, and it would be through the group, the Minnesotans for American Community Survey, or the census. Because we know that the census is really important to what services we get in our areas, especially, you know, the past couple of years, it's been all done online, or a lot of it's been online because of COVID. And we know that we have horrible Wi-Fi. And so a lot of our people were not able to answer or respond to those, which is going to affect us financially for a lot of the programs that we have. And we talked about Central on Aging. And Steve was able to talk to him about that. He's on that committee with Terrell. But we did meet with Pete, and it was a good meeting, and he's agreed to host a meeting with other congressional members about the importance of the census and what we can do to support our citizens to get that done. So that'll be coming, I want to say, is it this month or October?
They were trying to get it done before November.
Right, so yeah.
I haven't heard where they're at with that.
So what they were going for was accomplished. It was a good meeting.
So how does that work when, you know, they did the census?
Right.
And then Dave, you've touched on this when I asked this question a week or so ago, but I don't know if I got it all. But then there's this follow-up stuff that happens, these surveys, and it's boots on the ground. And it lit my phone up for a while because they thought they're scamming us. You know, I don't know, if they weren't wearing credentials or who was working or what was happening, but
It's something they've done for what, 100 years?
yeah, but how does
But
that
it's
data come in? How late is that to fine tune the data? That from
Is
the
it the
original
what?
census, you know, what are they looking to gather there?
they're looking to gather all the data for trends in an area. Is it aging? Is it younger people? Is it immigrants? Is it whatever? That's really what they're looking for, are those trends, I think.
Oh,
And they're looking
I'm not saying I'm anti this, I'm trying to
looking
understand
for-
it. So is it, do they add numbers to the census in the end so it has nothing to do with the numbers?
No, it does have something to do with the numbers, because there are some people that get missed, and they got a mathematical statistical grid that says if they call X amount of people and they get X amount of responses more than they got out of the census, that means that they missed 5% of the people in that geographic area to get counted.
Okay.
And so what we're concerned about, what we should be concerned about, is that we get all the people counted in rural Minnesota that actually live here, because that's how the funds are distributed. And especially in our area where we know our population is aging. And so if we don't have a good accurate count of the people over age 60, then we're gonna get less money
Yeah, I get that.
through all those older American Act dollars to help those people with programs that are designed to help those people.
So how do they count the homeless?
How do they count what?
Homeless,
Homeless?
they don't have an
That's
address.
another count that they do. They do that, I believe, on a certain day in February. That's a whole different thing. If I understand it right.
Yeah, and I know,
He
thank,
understands some of this stuff better.
thank you. If we want to understand how the Census Bureau counts people, we should invite them, right?
Yeah.
Because they'll give us more information than we know. The American Community Survey is an annual survey that is I don't know if it's like 1 million or 3 million or some relatively small number that asks all kinds of questions about demographics, income, et cetera, et cetera. And this group that reached out to Terry to coordinate that meeting with Congressman Stauber is focused on increasing the response to the American Community Survey and increasing the number of surveys that are distributed, because that survey is a statistical model that if you're in rural areas like Pine County you may not get enough responses to be statistically significant, and you either get missed or you can't do the breakout of, well, what is this township versus that township because there's no responses or too few responses. And so it was fascinating to get to learn a little bit about that, but it's complex enough that I can't today sit here and explain exactly. But we do know that when we apply for grants, like that broadband grant that we got, where we had to go and identify all the LMI areas, because that's where the broadband had to go. That all comes out of the census and the communities, the American Community Survey.
Yeah, I think I get it. It's a good data, but it's just, how do they know? You know, they're missing people. We have homeless people all over the place and we don't even know who they are. So how do they find them? And I know it's not part of that one, but it's
Yeah,
certain the people we have to serve
and
and take care of.
Somebody has determined that they're statistically not a big enough number, I guess. I don't know. You'd have, like David said, you'd have to ask them.
Yeah, thank you.
Any other?
I just want to say, I think it speaks volumes that they would reach out to Pine County and ask us to do a personal invite because they know that we have a good relationship with our representatives. I thought that was pretty cool.
Yeah, I did too. Thanks, Terry. Any other business? If not, we'll declare the meeting adjourned and we'll meet in 2 weeks.